45. I see that we now have quorum. Thank you to the arrival of the government members. This is our first public meeting, and our first witness is Ivan Zinger, Correctional Investigator of Canada, and he is no stranger to this committee, and it's my privilege to welcome you once again, sir. We look forward to your remarks.
Thank you, Mr. Chair, and thank you, members of the committee. Bonjour, je vous remercie de...
Good morning. Thank you for the opportunity to discuss my latest annual report with you. I want to focus my opening remarks on aspects of the organizational culture of the Correctional Service of Canada that are holding it back from embracing change and implementing reforms that the government issued to the new Commissioner of Corrections in September 2018. Coincidentally, on the same day that my report was tabled, the Office of the Auditor General released a report entitled Respect in the Workplace. This audit looked at whether the Canada Border Services Agency and Correctional Service of Canada promoted and maintained workplaces free of harassment, discrimination, and violence. In the case of Correctional Service, the Auditor General found that the service knew that these problems were present in its workplace, but had not developed a comprehensive strategy to address them. It is significant that the findings of two independent oversight bodies converge on this point of a problematic organizational or staff culture within the Correctional Service. The Minister's 2018 mandate letter to the Commissioner of Corrections directs her to make it an overriding priority to ensure that Correctional Service, and I quote, is a workplace free from bullying, harassment, and sexual violence.
Report suggests that certain ingrained habits, attitude, and behaviors have become barriers to reform. Though I have no mandate to fix the negative element of staff culture or labor relations, when conducting or when misconduct or non-compliance with the law creates problems or adverse effect for inmates, I have an obligation to report and act upon them. In the first case study entitled Dysfunction at Edmonton Institution, I found that both staff and management at this facility tolerated an established history of assaultive behavior perpetrated by a group of inmates against a subpopulation of protected status inmates. Evidence showed that the recurrent verbal and physical assaults on protective status inmates, which included throwing food, bodily fluid, garbage, and other degrading and humiliating acts, were planned and orchestrated events that actually increased and escalated over a 3-month period. My findings suggest that the cruel and callous nature of these incidents must be placed in the context of organizational culture that an independent human resource consultant concluded 3 years ago ran on fear, suspicion, mistrust, intimidation, harassment, vulgar language, and other abuse of power and authority, and this was among staff members. What can only be described as a culture of impunity impacted on how staff treated and responded to inmates. An abusive workplace culture perpetuated staff misconduct and contributed to the dehumanizing acts of violence among inmates. Both staff and management were aware of the repeated nature of the physical assaults and verbal abuse, yet took no disciplinary or remedial measures against the aggressor or step to protect the victims of these assaults and abuses. Though these incidents were initially reported and brought forward to senior management at Edmonton Institution by my office, it took over 3 months and the disclosure of indisputable video evidence to the Commissioner before even the basic remedial measures were put in place. Two other case studies help further illustrate the resistant qualities of organization culture of the Correctional Service. In the first instance, 4 years of use of force reviews reveal a recurrent pattern of deficient accountability, non-compliance with law and policy, and poor performance in managing use of force incidents at Atlantic Institution in New Brunswick. I found little evidence that implementation of a new engagement and intervention model introduced in the aftermath of the preventable death of Matthew Hines has made much of a difference in the manner, rate, severity, or level of force used at Atlantic Institution. Significantly, the reliance on pepper spray to manage prison tension and conflict behind bars has not diminished at this facility, nor indeed across the rest of the service. Finally, my office has been reporting on food issue in federal corrections for over 5 years now. We have made several recommendations, none of which has been actioned, and things have not changed for the better. A recent internal audit conducted by the service confirms several deficiencies previously reported by my office, including inadequate per diem, less than $6 per day per inmate is spent on food, inconsistent and substandard meal quality and portion sizes, failure to meet the Canada Food Guide requirements, inordinate amount of food spoilage and wastage, failure to consistently follow special diet requirements. One of the most significant concerns revealed by this audit is that the Correctional Service roll out its food service modernization project in the absence of an updated policy framework. To this day, the Correctional Service has not provided any evidence that this project yield expected cost savings or efficiencies. More significantly, the audit failed to drill down on the relationship between food and the order, safety, and security of institutions. The audit did not examine lessons from the December 2016 deadly riot at Saskatchewan Penitentiary, which linked food shortages, inadequate portions, and poor meal quality at this facility to the rising levels of inmate tension and protest, factors that eventually led to the riot. The rise of food as a commodity in the inmate economy is not probed, nor is the fact that inmate canteen now supplement or even replace daily meals. These issues are top-of-mind concerns at most institutions, yet this audit failed to acknowledge and bring them forward to management for correction. En dernier lieu, permettez-moi de conclure.
Finally, let me conclude by acknowledging the encouraging statements issued by both the Commissioner and the Minister of Public Safety in response to my report. Both reiterated their commitment to ensuring CSC employees have a respectful and healthy workplace. These statements are important, but they must also be seen in context of the statutory obligation of the service to, and I'll quote Section 70 of the 1992 Act, take all reasonable steps to ensure that penitentiaries, the penitentiary environment, the living and working conditions of inmates, and the working conditions of staff members are safe, healthful, and free of practices that undermine personal dignity. I believe parliamentarians and Canadians have a right to know how the service intends to comply with the law and fix elements of a workplace culture that perpetuates, condones, or otherwise gives license to violence, abuse of power, and mistreatment behind bars. Thank you, and I would be happy to take your questions. Thank you, Dr. Zinger. Mr. Potters, 6 minutes, please. Thank you, Mr. Chair. Hello, Mr. Zinger and Ms. Kingsley. I'd like to talk about supervision. In your report, you talked about the 2016-18 stats, 1806. You said those numbers are the highest in a decade, and you wanted responses regarding the lack of funding for supervision in the community. Can you speak to that, please? What I would say is, Correctional Service has funding that is more than adequate. If we look at funding for the ratio between inmates and the number of employees at correctional service, it's probably the highest ratio in the world. So it's about a 1-to-1 ratio. So for each inmate, there's at least one employee from CSC. In monetary terms, that's on average over $100,000 per year per inmate. I believe that the resources themselves are not an issue. It has more to do with the priorities. And it's more about reassigning that money. In terms of community, we're only talking 6% of the total budget, which is, in my opinion, insufficient. So it's really a question of redistributing the funds to make sure that the priorities are met. Sorry, I'm cutting you off a little bit because I don't have a lot of time. And in your recommendation in your report, number 11, you said that there are significant resources that should be redistributed, and you started saying that there was a ratio of a highest ratio for inmates to staff, but we're not at that ratio right now. It's problematic because currently in the community, there are offenders. Well, there's a lack of resources for a sufficient follow-up compared to what we had before. Is that accurate? Well, I'd say that the community ratio is 1-to-6, so 1 employee to 6. But it's evident that in the community, the ratio will never be 1-to-1. That would be absolutely insane. In my opinion, it's a matter of priorities, and there has to be balance. There's a lot of money being spent for imprisonment, and that's to the detriment of social reintegration. So there has to be a certain balance, and I think that 6% is insufficient. Currently, there's an increase in the number of paroles. We've seen a drastic increase over the last years, but we don't have the resources on the ground to make sure there's a follow-up. You talked about 1-to-6 for ratio, but what should it ideally be to make sure that we're looking out for the safety of those in the community? Well, I couldn't tell you what the right ratio would be. I think it's a matter of prioritizing sufficient supervision, and perhaps that's a question for the correctional commissioner. And in your report, you also talk about the Auditor General's report. This problem of supervision, and we saw this recently in Quebec. Everybody's aware of that situation. And so there will be a study on that in the following weeks. But the safety issue, well, I understand that the government, correctional service, wants to release more inmates, but if we don't have the resources that we need, is that not creating a public safety problem? Well, as I said, I don't believe that there's a problem of resources. It's a problem of priorities. What do you mean by priority exactly? Well, priorities. We have to ensure that if we're at the top in the world, at federal level, at the correctional service level, we have to be aware of the approach and ensure that we are putting the right resources where the biggest or where the greatest needs are. And in my opinion, a lot of money is being spent on old infrastructure, and therefore this does not lead to reintegration. And once inmates are released, they don't get the support that they should. So it's an issue. Do you think that currently we should be slowing down with the paroles and make sure we have the right resource on the ground? Well, I couldn't say. In my opinion, the law is being applied, is being enforced. There's an independent administrative tribunal that makes those decisions to release individuals. And I believe they do that in an exemplary way. Now, of course, there is an extreme case currently that's questioning the status quo, but the law is still being enforced, and public safety, in my opinion, is very much being taken into account. Thank you.
Dr. Zinger, Ms. Kingsley, thank you so much for your report and also the good work that you do. And I can't tell you how happy I was to see the two reports that I had initiated on Indigenous people and Indigenous women in criminal justice system corrections included in your report. There was good work done on this committee and on status of women, and I'm hopeful that some of the recommendations will come into fruition. One of the things that's been a concern of mine since I visited Edmonton Institute for Women was what women are being trained for when they leave. You mention it in your report that, textile business line is 83.5% of Corcan's work with women in the workplace. And last night I was reading the government's response to our Status of Women report, and it says that in 2017-18, the current employment skills training opportunities were reviewed, and Corcan identified opportunities for additional employment and employability skills for training at women offender sites to be implemented in 18-19. And then it says, consideration of labor market gaps, industry needs, and offender skills. In 2017-18, there was an increase in on-the-job and vocational training, and specifically in construction, maintenance-related training like flooring, painting, and chainsaw safety. So, Dr. Zinger, where's the disconnect there? Because even when I spoke to the warden at Edmonton Institute for Women, she indicated that this is actually okay to have women learning how to sew. And when I challenged her on that, it looks like that kind of thinking is still permeating through our institutions.
Well, thank you. First, thank you for the kind words you've mentioned about my office. I am very proud of the work we do. We have a small team of dedicated investigator and policy people and research people and corporate staff. So it's always good to get some positive feedback. I would tell you that I find, and I visited Edmonton Institution for Women, I find that when you walk into the work area and you see all these sewing machine and the women are sewing, last time I went they were sewing pillowcases that were pre-cut already, so you can see the level of technical skills required to sew a pillowcase. They were absolutely bored out of their minds. And these are women that are thirsty for additional education or skills that would be life-changing for them. So I don't think that sewing pillowcases really, and I have to say, I know wardens are trying very hard to bring in, different initiative, and some of them have been successful, but the numbers involving higher level kind of work is minimal. So I think the service has to change significantly its approach. I don't want to, the level of skills for sewing pillowcases is something that, yes, if we were reintegrating people back in China, that would make some sense. But this is not the labor force in Canada. We are looking at much more challenging. The manufacturing sector is healthy in Canada, but it requires a heck of a lot more higher skills to be part of that market. So that's all I would have to say.
You talk a lot about food prep in the report, and in that. The Cook Chill came about because of the debt reduction action plan that the Conservative government brought in. And I know when I visited the parole office in Winnipeg a few years ago, things like the police liaison officer were cut in the parole offices. There was a lot of negativity that happened, negative things that happened in corrections because of that DRAP, the Debt Reduction Action Plan. And so I know our government's been trying to catch up again, but certainly when it comes to food prep, that was skills that offenders used to gain while they were in prison, where learning how to be a chef, for heaven's sake. And now not only have those skills gone, but also the quality of the food, as you mentioned in your report, is decimated as well. So should we completely revamp that? And I know I only have a minute. What was the impact on DRAP in prisons?
Well, I think this was a bad initiative. It was ill-conceived, and departments were asked during DRAP, and these were austerity measures, which I'm assuming were legitimate, to provide some savings. And this is where the status quo would have been much better. I am very, very skeptical that there were any sort of savings based on what I've seen. And it was highly disruptive and had negative impact, including, cutting down on the employment opportunities and job opportunities that regular kitchen would provide. So very unfortunate, I would say, very, very unfortunate.
Thank you, Ms. Demov. Madame Michaud, 6 minutes, s'il vous plaît.
6. Thank you. 6 minutes? Hello. Thank you for being here today. We were talking about funding earlier. You were saying that that's not necessarily the problem, and that often we see that there are things that aren't working in the system, and it's because of a lack of funding. But you're saying the money is there and that there should be a 1-to-1 ratio, $120,000 per year per inmate, but that the problem is really with priorities. And that's what you've said. So what are those priorities? I think that the service needs to be considerably reformed. I think that there are 3 groups of individuals in prisons that they should be granted various accommodations. Indigenous individuals, I think it's important that another way of doing things be considered. Sections 81 and 84 of the Act allow the Minister of Public Safety to come to agreements with Indigenous communities or groups for a transfer, custody, and supervision of Indigenous inmates. And I think that Correctional Service should reassign a large amount of its budget to fund that transfer responsibility. That's the first thing. Now, I issued a report last year, and that was done, it was done with the Canadian Human Rights Board, and the report was about aging and dying in prison. And there are too many people who are aging and yet who pose no risk, and yet they're in penitentiaries. And often these people, they need palliative care. They're at the end of their lives. They've got reduced mobility. Sometimes they're even bedridden. And so I see no benefit in keeping them in prison. And I think there are other alternatives. The last group is a more restricted group of individuals who suffer from mental health problems, significant problems, or who are suicidal. And this could be a very chronic or serious case. This group of individuals should not be in penitentiaries. They should be transferred into a community where there are secure hospitals so that their needs can be met, their medical needs, that is. Thank you. So for these 3 types of individuals, we should focus on rehabilitation and then use that funding once they're outside of the penitentiary. Well, I think it's a question of reassigning the funds that the Correctional Service has currently for those 3 groups. Yes, absolutely. And the second aspect would be the community aspect. Our penitentiaries are very old in Canada. We have 3 penitentiaries that are over 100 years old. Stony Mountain, Saskatchewan Penitentiary, 2 penitentiaries that are full of Indigenous individuals. They're majority individual inmates. And the Dorchester Penitentiary is also over 100 years old, a very old infrastructure. As for the average, we've got penitentiaries that are between 40 to 50 years old. That's for most of them. They were built at a time when the correctional philosophy, well, it didn't give priority to rehabilitation. So I'm thinking a lot about the Edmonton Penitentiary, that's 42 years old. It's all concrete. There are very few rooms with windows, hallways. It's an incredible infrastructure. And I suggest to all members of this committee and others that you go and visit penitentiaries. You have a statutory right to visit those institutions. And if you're going to legislate on penitentiary matters, please go visit them to see exactly what the consequences are of the acts that you are adopting. Thank you. 1 minute. If we go back to Indigenous peoples, you're saying that we need a complete overhaul and a reform. There's some things that were re-implemented in 2019, a memorandum of understanding. For example, have you seen the results of those new things that were implemented, especially for young Indigenous people? Pardon me. Well, there was a memorandum of understanding in 2019 for the release of Indigenous individuals, for example, giving them ID before they were released so they could have access to the health system and whatnot. Are you seeing the results of that measure? Correctional Service did react to one segment of the Auditor General's report and put forward some initiatives. The idea was to improve case management for Indigenous individuals. The idea was to accelerate the process, accelerate classification, and so on. Yes, it's had a positive effect. But nonetheless, those results have to be analyzed a little more critically. We look at those who are prioritized. They're often offenders who pose less of a risk.
À moindre risque.
Yes. I'll end there.
It's helpful if you occasionally, and including the witnesses, glance at the chair, because I don't wish to cut members off. But as Mr. Harris will know, can do that. Mr. Harris, please.
Thank you very much, and thank you for the warning, the implicit
6 minutes,
warning.
yes. Well, I know you well, Mr. Harris.
Thank you, Dr. Zinger, for joining us. And I have to say, as a recently returned member, I'm not current with all the goings on in the Correctional Services of Canada, but I do have looked at your report, and I admire your dedication and objectivity and the compassion to which you bring to this job. And I have to say, having read your report and noting the statutory obligation of CSC that they have to take all reasonable steps to ensure that the penitentiary's environment, the living and working conditions of inmates and working conditions of staff members are safe, healthful, and free of practices that undermine personal dignity. I have to say your report is a shock to me, returning to this situation. And I should say that it must be a shock to Canadians to know how far from that standard that your report indicates, and it's worrisome to me, and it would be more worrisome if Canadians weren't equally concerned about making changes to this. Let me ask you a couple of questions. You referred to the inmates, the population of inmates with mental health problems, and it's a major issue across the country. We do know that many inmates find themselves in prison as a result, in large measure in some cases, of their mental health problems. Do you have a number that could tell us what percent of the prison population are affected by this, to the extent that, as you suggest, they ought to be treated differently as a result of their mental health condition? Is there a number that you can put on in terms of percentage?
Well, I can tell you it's always difficult to talk about prevalence because depending on what you're trying to target, you can come up with different numbers. So if you talk about the prevalence of inmates upon admission that have any mental disorder, including substance abuse disorder, you're looking at 75 to 80%. If you are looking at a much more narrow definition and you're looking at people who have previously known as Axis 1 disorder, people who basically are disconnected with reality, have maybe suffering from schizophrenia, major depression, or things of that nature, you're looking at 7 to 8%. So I think the best prevalence data that I use is that upon admission, how many people need psychological or psychiatric services, and that number is about 29%, which is way off the charts compared to the general population, Canadian population.
And can you indicate to what extent you believe that they're actually getting that help that they need?
Well, I think this government has certainly provided more funding for access to mental health care. I think it's the Correctional Services Canada is still catching up because the numbers are growing and very significant. I will tell you that my most the greatest worries that I have are for those small numbers of inmates that are acutely ill or are suicidal or chronically self-harm in a serious way. Those are the ones that I would like to see them move to external psychiatric secure facilities. Our best estimate would be there would be about a dozen women that would meet the criteria, and about 24 men that would also meet that definition. Those have no place in a correctional facility. They are patient first.
Thank you. You've reported, of course, and we're aware of the overrepresentation of Indigenous prisoners in our prison population, and the numbers, I think, are around 30% nationally. My own experience is, having gone to law school in Alberta, that in certain parts of the country that number would be considerably low in terms of the prison population. Do you have statistics by province? Could you say whether there's certain places, certain parts of the country where that overrepresentation is even more acute?
You have about 1 minute.
Yes, you're absolutely right. Where there are higher concentration of Indigenous people in the population, then you'll see that percentage is much higher than 30%. So I'm happy to provide the committee with some tables with a breakdown by regions. Absolutely, I can provide that to the committee.
Have you had a look, Dr. Zinger, at the Truth and Reconciliation Commission's calls to action between number 30 and number 40? There's a series of recommendations that the government implicitly adopted in 2015, one of which was to reduce the number of overrepresentation of Aboriginal people over the next decade. That was 2015. Any evidence that any of these recommendations, calls to action, are being implemented?
That's a very important
much to show
question.
for it.
Unfortunately, Mr. Harris has left you no time to answer it. Once again, I would encourage members to occasionally look at the chair so that we can maintain the clock. Mr. Morrison, 5 minutes, please.
Thank you, Mr. Chair, and thank you, Dr. Zinger, for being here today. You briefly mentioned earlier part of this, I think, question that I have, and in your report you highlighted CSC allocates only 6% of its budget to community supervision program. When you consider that there's 40% of the offenders are in the community, how do you explain that?
Well, I think when you're looking at supervision in the community, there's different level of risk. So some individual require close supervision, and some don't require as much supervision, that they have served their time and they are, law-abiding citizen and contributing to society. So it's just a question of how do you manage risk in society, and this is something that I think the commissioner could probably answer better than I can to justify why just 6% is invested in the community.
You think that's adequate?
No, I don't think it's adequate. I think that we are, as a society, we are spending too much on incarceration with very little return, and I'm concerned that we could do a heck of a lot better with the money that we are currently spending. I think it's a question of value for money here.
Okay. I also noticed in your risk assessment findings that you supported the need for an independent, or would you support the need for an independent review of the rehabilitation programs, given that there's such a huge impact on the reintegration and safety of the public?
Can you be a little bit clearer as to what you're suggesting?
What I'm asking, do you think there should be a separate independent review of that program?
My office has been critical of the transition between when the programming in corrections moved to their new integrated correctional program model. This was done maybe about 6 years ago or so. It was done for efficiency reasons, and there's some academic literature that is critical of how program has rolled out. There used to be separate programs for substance abuse, anger management, family violence, and what happened is with the introduction of this new model, ICPM, they basically threw everything in the same basket, and now you have one program that fits all. I think it's an approach that may not be yielding the best results, and the academic literature suggests that may be the case.
Okay. In some past meetings with correctional officers, they noted that the needle programs in other countries are operated as safe injection sites. Specifically, needles remain in the hands of medical staff and aren't brought back into cells. Is this the case in Canada?
We wrote in our this past annual report our concern that the Safe Needle Exchange program isn't working as it was supposed to, because most of the attention has been focused on security as opposed to health and harm reduction. So there are very few takers. So we're concerned that the present model as implemented by the service does not match best practices in other jurisdictions. It's clear to me that a good program reduces the spread of infectious diseases and also lower the risk to staff. So it is there's a number of if you don't have a proper prison needle exchange program, you increase the risk of staff being pricked by needles during searches, whether strip searches or cell searches.
Yep.
Once you have prison needle exchange, those things go
Okay,
away.
thanks very much.
Thank you, Mr. Morrison. Madame Kara.
Thank you, Dr. Zinger, first and foremost for being here, but most importantly for all the work that you've been doing, especially on this particular report. This report certainly raises many pressing issues, which includes gaps in services and care for the most vulnerable populations in our federal institutions. And I know Correctional Services Canada has put a path forward, and I know Minister Blair is working very closely with CSC to ensure that real progress is made. But I do want to talk a little bit about safe and timely reintegration. In your report, and you cite the Senate study on human rights of federally sentenced persons, the most basic human right is to be treated as a human being. And it states that an important consequence of discriminatory policies is that federally sentenced persons, especially those who are women, Indigenous, Black, and racialized, have difficulty accessing culturally relevant programming, and without access to these programs, federally sentenced persons are ill-prepared to reintegrate in their communities, which places them at a higher risk. Tackling this issue is particularly urgent for federally sentenced Indigenous and Black persons who are significantly overrepresented in the correctional system. And I know within your study it states that the population of Indigenous persons has increased from 19% to 28% in 2015, 2016, and also for Black persons from 7% to 10% in 2015, but now it's slowly reversing. And yet, 37% of all discrimination complaints are from Black persons. Can you elaborate a little bit on the overrepresentation of vulnerable populations, especially Indigenous, Black Canadians, as well as racialized communities in the correctional services?
Yeah, well, on January 21st, I issued a press release specifically on Indigenous people in terms of their gross overrepresentation. 4 years ago, they were 25% of the federal inmate population. Now they're 30%. And this has been going on for the last 3 decades. It keeps growing year after year after year after year, independent of what government is at the helm. So I think it's beyond I would say it's beyond a crisis right now, and we have to look at not just tweaks but bold initiatives to address this. With respect to inmates of Canadians of African descent that are incarcerated, the overrepresentation is maybe not as acute, but certainly worrisome. So they represent about 8% now of the inmate population, when in the general population they represent about 3%. So what when we conducted a systemic investigation on younger offender age 18 to 21, we looked specifically at that group, and whether it's Black or Indigenous, there's a lot of young men, there's a lot of gang affiliation, and too little is being done to either by the Correctional Service Canada to either have programming to disaffiliated or prevent affiliation.
Thank you. And is there urban divide also between specifically to Black Canadians and especially our young offenders?
Yes, I believe so. Yes, there are definitely pockets of where those communities are more in contact with law enforcement, absolutely, in some urban settings. And that would include, Toronto and Halifax, for example.
Thank you.
Still have 45 seconds.
Gagan, you want to?
So these are questions through a constituent, through me. She works at a women's facility. So the first question is, are there statistics on the effectiveness of random strip searches? Yes or no? Effectiveness of strip searches.
Yes, yes.
And are the inmates working in the Cook Chill facility there to reduce costs as they are in the province? Yes or no, please?
Yes, I believe that's
Okay,
part of
thank
the.
you. I'll circle back when I.
Okay, thank you.
All right. Two very efficient questions. Mr. Dalton?
Thank you, Doctor, for your report. Just a few questions. You say that about, as far as day supervision, the costs are about 1/4 as opposed to of the cost as far as being incarcerated, and the numbers are increasing as far as as far as people being released on day supervision. But you make mention of inadequate supervision. Why isn't there? And coupled with all this, that we have the highest, I guess, investment in our penitentiaries per capita, as far as per inmate, is, if you can clarify that. So my question is, why isn't there a change? Why aren't we allocating? Why isn't there an allocation more towards supervision? Because obviously it's increasing and it's a lot more less expensive. So maybe you can comment on that.
I have to simply agree to you, but clearly the person best placed to answer that question would be the Commissioner of Corrections as to how she decides to where she makes the allocation of her resources.
Okay, thank you. There's La Presse had a comment or an article talking about Quebec criminals being able to, well, I guess it's elsewhere too, but there was situations happening where they could, inmates could just declare themselves as Métis and receive a lot, significantly improve some benefits. So without necessarily any proof of attachment to the Métis community. I'm speaking as a Métis person myself. I'm concerned about that. I'm wondering if you can make some comments as far as this Indigenous being Métis is not being abused, by those that are not.
I've read that article. I think it's misguided. I've actually written to the author and provided some statistics. I think this is red herring. I don't think that this is. It's based on facts. The reality is that if you are Indigenous in our system, in federal corrections, you're more likely to be released later in your sentence. You're more likely to be subject of use of force. You're more likely to be self-harming. You're more likely to have your parole suspended or revoked. There's no real benefit in declaring yourself Indigenous. And the statistics that I provided that person, that reporter, shows that there have not been a wild increase in people. I think it's there may be some cases of abuse, but certainly nothing systemic that I could see from the numbers.
Good, I appreciate those comments. And you alluded to the numbers as far as those that are, as far as the Indigenous population being released later, that the number that are released on day parole is 18%. How does that compare with those that are non-Indigenous population, those on percentage of inmates on day parole as opposed to the general population?
I have my office provide the committee with precise answers. When it comes to statutory release, the bulk of inmates are being released at statutory release, which is at 2/3 of their sentence. For Indigenous people, it's over 70%, and for non-Indigenous, it's slightly over 60%.
One last question, and this isn't referred to in the report, but whatever you can make a comment. And having talked to many correctional officers, there is a real concern about solitary confinement being not being able to be used as has been in the past, and just their tools as far as discipline are really being constrained. Do you have any thoughts about this?
Well, I think this government brought in new legislation to eliminate solitary confinement as defined by the Mandela rules, or the standard minimum rules for for prisoners. And the idea is to ensure that inmates are spending at least 4 hours outside their cells with the possibility of more human contact. It's a step in the right direction, but I still question whether it's going to be sustainable over time and whether the due process protection are sufficient for the loss of liberty and the harsh conditions of confinement that remain, because 4 hours,
Thank you, Mr.
Thank you.
Dalton. Mr. Lightbound, 5 minutes, please.
Merci, Monsieur le Président. Je vais prendre
Thank you, Mr. Chair. I'll share my time with Mr. Sikand if he has questions. Mr. Zinger, Ms. Kingsley, thank you for being here and thank you for your report. It's very useful and it shines a light on the correctional service. I'd like to hear you speak about one recommendation that has to do with inmates who are at the end of their lives and their parole. Can you talk to me about the benefits that you observed during your report and perhaps more broadly regarding parole as it concerns rehabilitation and reintegration? So we did a report on aging and dying in prison. It's a segment of the prison population that increased over the last years. We're talking now about over 25% of the prison population, which is 55 years or older. They have a lot of health problems, physical health and mental health. So we reflected on this question and interviewed over 250 individuals. They were, some were incarcerated, some were released. We were quite shocked to see that this segment of the prison population is aging and has all kinds of health problems. Alzheimer's, dementia, being at a terminal phase of their illness, palliative care, and we have a hard time understanding why the service is not developing a national strategy that would facilitate the transfer of these individuals into the community. The service has always told us that one of the problems is that there aren't enough beds available in the institutions in the long term. In the nursing homes, that is. And so the answer we give the service is that they shouldn't try to compete with the number of available beds in the community, but rather buy and purchase those beds, rather. The cost is extremely high to keep an aging individual. It can be 2 to 4 times higher than the average cost, the average being $120,000. So multiply that by 2 or 4. That's how much it costs to keep someone in an institution. It makes absolutely no sense. We're talking about human dignity here. The risk is negligible for these individuals, and it just makes no sense. Mr. Chair, how much time do I have left?
Sure, with his usual efficiency, there will be quite a number of questions.
Thank you, Chair. Thank you, PS Lightbound. And thank you, Dr. Zinger. Apologies for the rapid round previous. Just to close off the first question, and as I was saying, this is a constituent that lives in the riding but works at a corrections facility just situated outside the riding, and it's a women's facility. So as to the effectiveness of the strip searches, what trauma-informed methods will be used if the search for the women were to be replaced? So body scanners or other technology?
I think you allude to part of the report that in an institution where they do these, they have this count that is triggered so that 1 every 3 women have to be strip searched coming out of visitors. There's no evidence to show that that has actually mitigated any sort of risk to the institution with respect to contraband or bringing in some drugs. It is not a process that is done uniformly across the country, and some institutions are ensuring safety of those women without having to do those searches. So I think we have to be cognizant of the past traumatic events that happen in the lives of those women. Over 80% of these women have been either sexually or physically abused. So strip searches should be done, of course, when there's reasonable ground to believe that the women have brought in something, or that there is something but there have to be evidence. I think it's not proper or ethical to do such random searches.
Thank you, Mr. Sicken. Madame Michaud, 2.5 minutes, s'il vous plaît.
Merci, je continuerai.
2.5 minutes for Ms. Michaud. Thank you. I'll continue on that same topic. You're proposing that those be eliminated automatically. Now, how is it that that's happening in some places and only after the visit for some? Well, why is it that it's only done for some and not for others? And why is it not the same everywhere? And what would it be replaced by? Well, we have to talk about best practices. That's one of the problems with correctional service. It's an organization that is highly decentralized. And depending on the situation locally, some inspectors or wardens take certain initiatives. And what's important is to use the same practices all throughout the service. That's the major issue, in my opinion. Could a training session be given on traumas of this type? You also talk about transgender individuals who are imprisoned. So could there be greater awareness, more training for agents for these types of problems? Well, of course, training, in my opinion, is always important. This type of policy that's applied to the entire prison population, well, it's not always the best way to prevent the drugs coming into the penitentiaries, for example. There has to be a case-by-case process. They have to take into account dynamic safety. Correctional agents play a very important role. They have to collect data. Data has to be collected on drugs that are entering the institution. These are the types of things that need to be promoted. This needs to be dynamic security and not static security.
Dr. Zinger, an opportunity to answer my previous question in terms of, given the direction of the problem of overrepresentation of Indigenous persons, have you seen any indication that the recommendations or the calls to action of the Truth and Reconciliation Commission have actually been implemented or had any effect on the situation of Indigenous persons in prison? And how are they being taken seriously?
Well, I can only answer with respect to recommendations that are been targeting the criminal justice system, but more specifically corrections. I can tell you that for the call of action, as well as the inquiry into the missing and murdered Indigenous women, there were many recommendations that mirrored those of my office. And the most important one that I think requires a lot more thinking and effort is the one that I spoke about, which is to shift some of the funding and responsibility for more of those Section 81 and 84 agreements, which would allow, again, the Minister of Public Safety to enter into agreements with Indigenous communities and groups for the care, custody, or supervision of Indigenous people. That, in my view, would be the greatest contribution to the call for action for corrections. So their contribution should be a huge shift of resources.
Thanks for that particular focus. I want to just talk about the issue of support and resources for those on parole in the community. And I'm looking at your recommendations 11 and 12 and your discussion about resources allocated in that direction. Obviously, there were benefits for those being supervised, but are there benefits also for the notion of reintegration into the community being a positive thing, but does that have implications for public safety and risk management as well?
Yeah. Well, I think we spend an inordinate amount of funding on incarceration with returns that are not great. So when I talked about Indigenous people, when you look at recidivism or reoffending rates of those who come from the prairie region, we're looking at 70% reoffending rates. That has a public safety certainly aspect to it, and it's the job of corrections to ensure that reoffending rate is the lowest possible, and it's not currently in serving time at Saskpan or Stony Mountain or Edmonton Institution that you are going to be able to address some of those long-standing issues related to mental health,
Dr.
substance
Zinger, we're
abuse.
going to have to leave
Thank you.
that answer there. Thank you. Mr. Shipley, 5 minutes.
Thank you, Chair, and thank you, Dr. Zinger, for your report and being here today. Dr. Zinger, your report noted that in 2016-2017, there were 8,886 offenders released for community supervision. That is the highest number in the past decade. Why are so many offenders being released?
Well, we do have a parole board of Canada that makes those decisions, and if the board views that the offenders do not pose an undue risk and can be managed in the community, then that would be part of the answer. So I would suggest that you ask that question to the chair of the parole board or the commissioner of corrections as to why those numbers are rising. As I say, and maybe I should address this, the case of Marlene Lévesque. First, would you like me to address this? Is that of interest to the committee? Or
Very much.
My
I think
conservative
this
colleagues are extremely interested.
Yeah, very much.
Okay. So let me make first. I would like to take that opportunity to provide sincere condolence to the family and friends of Miss Marlene Lévesque. I would say that I have two preoccupations with this case, and the first one is that this is an extreme case, a very rare event where somebody who committed murder is released and committed murder again. To my knowledge, this has happened only more than 8 years ago. And the preoccupation for me is that those extreme cases test the system as a whole, and there's always the danger that those extreme cases can result in bad policy and bad law. So bad cases make for bad policy and bad law. So we should be conscientious of that extreme case. That doesn't mean that it shouldn't be looked at very carefully, because it's a blatant failure of the system. My second preoccupation is with respect to the first one, flows from the first one, is that when you have such an extreme case that happens, what kind of investigation do you need to put in place? For me, it has to be a very credible investigation, and that requires independence, certainly, and and also the level of investigative tools and powers associated to ensure that you get to the bottom of it. What I find in this case is that we have an investigation that is going to be conducted, that was convened by the commissioner and the chair of the parole board jointly, that it's basically an internal investigation, and I think that is, in terms of the process, problematic. When you have allegation of wrongdoing where you are possibly going to be looking at negligence in carrying out their duties, you shouldn't ask the agency responsible for that to investigate themselves. That is never done in policing. That should never be done. And I've made similar recommendation when egregious cases happen in corrections. Last year, I made the recommendation to the Minister of Public Safety, when there's death in custody following a riot or following a use of force by correctional officers, these things should be investigated independently with all the right tools, and that can only be done, in my view, under the Inquiries Act. Not an internal investigation.
Thank you, Dr. Zinger. We're getting very short on time. Thank you for your answer there. We agree that it should be an external investigation. Who specifically do you think should be doing that investigation?
It should be called upon the government by under the Inquiries Act, completely independent. And then your committee could then review an independent, where there's no perception or risk of being self-serving. So when I reviewed the investigation conducted by the service on Saskatchewan Penitentiary, I've made the call that following a riot in December 2016, that investigation was self-serving. It didn't go to the bottom of it. And again, it's a question of, do you call, when there is serious wrongdoing, do you ask the agency that may have been responsible for it to investigate themselves? The answer should be no.
We'll have to leave the answer there. Thank you. Mr. Iacono, 5 minutes, please.
Thank you. Doctor, do you recall the name of the similar incident that occurred 8 years ago?
I think it was in New Brunswick. I would have to dig it out.
Please, if you can provide that to the committee. Alors, Dr. Zinger, dans votre rapport, vous mentionnez...
Dr. Zinger, in your report, you mentioned the need to... you mentioned the need to have alternatives. What exactly do you mean by alternatives? And do you have some ideas? Do you take some inspiration from other countries for this type of act? For example, maybe Scandinavian countries with electronic bracelets and such? Yes. There are clearly alternatives that could be made to the laws. Conditional sentences could be one opportunity, one thing to consider, but all of this would be upstream of the correctional system. And we're talking about the correctional federal system. I mentioned 3 groups of individuals who I think would benefit from a new approach. I talked about aging and older individuals who could be released without posing a serious risk to society. I talked about indigenous peoples and healing lodges that could be created in partnership with indigenous communities. And I talked about those who suffer from acute mental health problems, or who are suicidal, or who self-harm significantly. So those are 3 groups where we could do things differently. In your report, you also indicate that prisoners do not have enough food on a daily basis, but you also mention that there's a lot of waste of food in prison. So these 2 things seem to be contradictory. Can you please elaborate on that? Well, it's quite extraordinary. After 5 years, we've seen what's happened with food management. There are more and more inmates who use their own money to go to the canteen to avoid eating the food offered by the institution. Certain wardens told me that they rarely cook for 100% of the prison population. Sometimes it's only 1/4 or 1/3. What we've seen is that inmates are now using their own money, very small amounts of money, to buy their own food, to supplement or completely replace their meals. I'll give you some examples. The last institution that I visited, which was the Millhaven Institution, they gave me the canteen list, and historically, they offered chocolate bars, chips, things like that. But now, the canteen has become like a mini grocery store. You can buy canned salmon, tuna, spaghetti sauce, sardines, mackerel, all types of things. Frozen foods as well. You can get chicken breast, chicken wings, and so on. Thank you. I'll give the last minute to my colleague, Mr. Sikand.
Any other strategies that would be effective? And is there any merit to staff-run committees that could be implemented?
I'm sorry.
So besides the EIM, what other strategies would be effective? And is there any merit to staff-run change?
EIM being the engagement and intervention model. So the question is the implementation of it that is problematic. We've made the recommendation. It's actually an Ashley Smith recommendation that we've made many years ago that was finally put forward and the services finally accepted in the case of Matthew Hines. So in response to our report, they changed the actual model, and it's supposed to promote de-escalation. It's supposed to of tension. It's supposed to result in more reassessment of the situation, and it's supposed to also ensure that when you have a medical emergency or you have a person that has some mental health issues, that you respond differently with the assistance of healthcare. That's all good in theory, but in terms of practice, we haven't seen yet the results of this.
Okay, we're going to have to leave the answer to that there. Mr. Sikand, I think, has another round in any event. Monsieur Paulus, 5 minutes, peut-être.
Merci, Monsieur le Président.
Thank you, Mr. Chair. We were talking about the needle exchange program. In your report, you say that there are very few applications, fewer than would be expected, but the needles are there. Is everything all right? Thank you. They're injecting drugs that have been obtained illegally. So do you not believe that that is why prisoners are not applying for these needles? Because they don't want to be automatically recognized as drug importers? Well, best practices in other international jurisdictions show us that this type of program is run by the health centers, so nurses and doctors. The Correctional Service put in place another way of doing things. Their approach focuses on safety measures. There are risk assessments that have to be done so that someone can benefit from the program. And essentially, this is the reason why there are very few inmates who benefit from the program or who want to benefit from it. It's because the focus is not on reducing harm and health, but the injection is, they are injecting illegal drugs, In fact, the need for needles would not be there if there weren't drugs coming into the penitentiary. And there was already this discussion of body scanners. And I was told that more than 90% of the drugs are coming in through visitors, and so there would be body scanners for them. Don't you think there should be an accelerated process for getting those body scanners in? And second of all, I'd like to have your opinion. Correctional Service is clear that the needle program is very dangerous, and they've been mentioning that since the outset, and they'd like to have those body scanners as soon as possible. So what would you say to our agents? I would say that there's a lot of misinformation out there. The jurisdictions that introduced this type of program noticed a decrease. It was a decrease in cases where a needle accidentally injects someone else. There was a huge decrease in incidents. And so I think there's a lack of information on that front, because that's the reality. Assessments in other jurisdictions have shown that there is a significant reduction in this type of accident. And it does not at all jeopardize the agent's safety. Well, we can talk about that some more another time. I'll pass that on to my colleague, Mr. Morrison.
Issue that I've had a bit of experience with, and I'm wondering if you would support this, and that's maybe a separate program focusing on a drug rehabilitation, for example, crystal meth addicts. Rather than going directly into the prison system, going to another system which focuses on a rehab program specifically, rather than in the general population. I know crime reduction is pretty easy, just put people in jail, but crime prevention is very difficult and is a long-term program. I know the UK has a similar program because I've been over there and investigated that. I'm just wondering if you have thought of that or what your opinion is, please.
Well, I think correction has spent an inordinate amount on interdiction measures and to trying to prevent drugs from going into the into penitentiaries. We have spent hundreds of millions of dollars on all sorts of initiatives. And those initiatives have not yielded the results that we would expect. And that is, the evidence shows, for example, that random urine analysis tests that are positive have not changed dramatically or significantly since we've spent all this inordinate amount. So we have to, so it's usually around 6 or 7% of all random urine analysis that come back positive, despite all the money that has been spent on interdiction measures. So I do agree with you that more has to be done in world-class programming and treatment for addiction in prison, and also much better harm reduction strategy, including healthcare-driven prison needle exchange in prison.
We're going to have to leave it there. Mr. Ananoko, I believe you have a question, and then Ms. Damoff after that.
Yep. Monsieur Docteur, vous mentionnez dans votre rapport que les...
Doctor, you mentioned in your report that inmates don't have health cards in federal institutions, and they don't have other ID. Can you please clarify that? What happens if an inmate has to go to the hospital? The person must have a card. Well, this is one of the problems that we've been documenting for years now. It seems to still not, it still hasn't been settled. We're talking about prioritizing a segment of the budget of correctional service for the community. Sometimes it's as simple as that. When people leave the penitentiary, they should have all the identification that they need to ensure they have access to health care. For example, if they need social assistance, or if they need doc ID to apply for a job, And this is where it's really critical. These are very simple things. And now, do they have those cards already when they're incarcerated? Well, no, because sometimes they're there for years. So it's when they leave, that's when they need to be prepared. Then they need their birth certificate so they can apply for things. Okay, I understand when they leave, but when they're still within the institution and they have to go to the hospital, for example, what do they bring with them if they don't have their health card? Well, the federal services pay for health care when they're in a federal institution. Thank you.
Aware that correctional services and Indigenous services have signed an agreement that people can get their status card, Indigenous peoples, when they leave prison immediately. That was one of the, it's a start. It's certainly not the solution altogether, but it seems the federal government can at least arrange that with their own departments. When you get into birth certificates, health cards, that's provincial and it makes it more complicated, right? Everybody seems to agree that we need more Section 81 and Section 81 or 84 agreements done. We need more healing lodges. We need to get more Indigenous peoples into healing lodges. What's the challenge that the government is facing in getting that done? That was a recommendation from our committee. It's been your recommendation as well. So what kind of challenges is the government facing in getting that accomplished?
Well, thank you for the. I'm glad to hear that there's some progress with respect to some of the ID cards. And I say, for me, what the frustration is that some part of the service does that very well, and there's some best practices, but it's not nationally available everywhere. So that's the challenge for the service, is to implement best practices so that the ID card issue is resolved. For the Section 81 and 84, part of the pushback from the service has always been, well, some Indigenous communities have no interest in taking on some of those responsibilities or don't have the capacity. And I think we have to challenge that and really engage those communities to see over, for example, a 10-year period, how you could change the face of corrections and really shift that responsibility to Indigenous communities. I think it has to be part of a very large initiative that would see the transfer of hundreds of millions of dollars to Indigenous communities over a 10-year period. And these things are big-ticket items that bureaucracy, unfortunately, are always not well equipped and adapt to do, which is to hand over money as opposed to retain the funding. I think there's obviously such an approach would be quite bold, requiring lots of efforts and partnership and sustained change. And government are often ill-equipped to deal with these kinds of major initiatives.
Thank you, Ms. Damoff. We have literally 4 minutes left, and we have two more questioners, Madame Michaud and Mr. Harris. So I'm going to arbitrarily cut you back to 2 minutes each, please.
Je vais faire ça rapidement.
I'll be very brief. You made 16 recommendations. I know they're all important. What are the most urgent ones for an overhaul of the system, as you mentioned? What should we start with? One thing I indicated concerned the corporate culture. I believe there are fundamental changes that need to be made to change that culture. The culture needs to be more open in order to improve accountability. So I would really like to see this open culture. And there's the Truth and Reconciliation Commission that made recommendations as well, and the inquiry into murdered and missing Indigenous women. They had recommendations as well. So the service needs to change its approach and perspective in order to be more open to change. And they need to put forward initiatives that are practical with very specific time frames. This way, the mandate letter from September of 2018 will come to fruition.
I'd like to follow up on the question regarding treatment for addictions in federal prisons. It's a pretty big question, and organizations in my riding are very concerned about the fact that the Correction Service doesn't often listen to the people who have expertise in the community. What would it take to try to attack that problem? Do we need separate units, for example, in prisons to perhaps isolate those addicts from the rest of the population for a time to go through a rehabilitation process, or is there some other recommendation that you have?
Well, again, I think it's a question of priority, and I think it was raised previously on how do you balance interdiction measures with rehabilitation, with harm reduction. My view is that upon admission, the bulk of the prison population requires some substance abuse treatment. And we should have when we spend the amount of money that we are spending on correction, we should have state-of-the-art treatment right from the beginning and sustained throughout the incarceration, and spend more money on treatment than we are on the latest gadget that may or may not prevent drugs from coming in.
And thank you, Dr. Zinger. On behalf of the committee, I want to acknowledge that you have shone a light on the system, and it's not a very pretty light. I take note that the Auditor General has released a report that the two House of Commons committee reports, one Senate report, all of which and many of which all seem to say the same thing. Subsequently, there was an agreement by everyone acknowledging that these are the recommendations and that they are very important recommendations, but not much seems to change. So I appreciate your persistence, and I'm rather hoping that the committee will see some means by which it should follow up. So again, thank you for that.
My pleasure.
With that, we're not quite formally adjourned. This motion should have been passed out at the beginning of the meeting. I'd ask somebody to move it. Gagan has moved. Debate. Seeing none. Motion's passed. Thank you very much. With that, we adjourn. And those of you who are on the subcommittee, if you would hang around. And it will be an in-camera meeting, so I'd ask that the room be cleared more quickly rather than less quickly. Thank you.